So our other recommendations, as you can see, I've distilled them from the 76 in the report. Portable assessments. What we've recommended in relation to portability is that if it is known that somebody wants to move, say, from Newcastle down to Cornwall, the receiving authority, in that example, Cornwall, would be able to carry out an assessment before the person arrives there as a result of this enhanced duty of cooperation between the two authorities. That would mean that the relocating person would know what their care package would be when they arrived in Cornwall. We're not saying it's obligatory to do so, but we've given them the power to do so as a result of an enhanced duty of cooperation. And that leads on to the next one under that as to duties to cooperate. We're suggesting that there is a general duty to cooperate between the relevant agencies such as social services and health service and the police. But in certain circumstances, such as in relocation, such as in adult protection, there is an enhanced duty of cooperation. And what that means is that when another authority is asked by the lead one to do something, that they have to respond and they will have to provide reasons as to why they're not prepared to do so if they refuse to do so. And that then is something which may or may not be taken further by the initiating authority. So far as ordinary residence is concerned, we haven't gone into the definition of ordinary residence. That was outside our particular remit, but it will apply across the piece to all the services. So far as the health and social care divide is concerned, that again was a very live issue through the consultation process. And what we have suggested there is that the quality and quantity test, which comes at present through case law, through the case of Coughlin, is actually to be set out on the face of the statute. So that will determine which health services the social services authority can provide. So in other words, there will be increased clarity as to which appropriate health services the social services authority can provide. And that again, in terms of having the quantity and quality test on the face of the statute, is something that the Dill Not Commission are strongly supportive of. So far as transitional services for young people are concerned, so this is dealing with 16 and 17-year-olds, there are occasions, normally they would be dealt with, of course, under the Children Act, but there are occasions when it might be advantageous for them to be dealt with under our proposed adult social care statute. And if that is the case, then they can make a request that they are going to be assessed under the adult social care statute, or indeed their carer can, or indeed their parent can. And the local authority then has to consider that, and assuming it's appropriate to do so, carry out an assessment. That has obvious advantages for the transition between children's services and adult services, and hopefully will improve what we understand from consultation as being quite a difficult area in practice at present. So far as Section 111 of the Mental Health Act is concerned, what we are suggesting there is that is recast as a gateway provision to social care services. So at the moment it's freestanding under the Mental Health and Health Act, and that's services are provided in terms of aftercare through that. In its recast position, then the service user would be entitled to the range of social care services. We're suggesting that Section 21 of the National Assistance Act is retained, and we've also recommended that so far as advocacy services are concerned, that there should be a statutory advocacy service. It's up to the government, of course, when they implement it. Whether they will do, who knows. But anyway, we have made that recommendation. Now, I just wanted to say something about the Dill Not Report, which was published last week. The headlines you can see there, and then just deal something with the interrelationship of the Dill Not Commission and our recommendations. As you're probably aware, Dill Not's recommending that there should be a cap on lifetime contributions of £35,000, that the means test threshold is increased to £100,000, that there is free care for disabled people under 40. So, and that's recognising that people under 40 may be born with a disability, and therefore they haven't had the opportunity to acquire the assets that others have. They're also recommending there should be national assessments, national eligibility criteria, as I've mentioned, and portable assessments, in which case, as I've said, they support what we're recommending there. They're also suggesting that there should be a duty to provide information and carers' rights, which is supporting our first stage of the assessment process, and they quantify that it would cost an extra £1.7 billion a year in terms of government spending. All of that we are confident can be achieved through our statute, and in fact, looking at the Dill Not Report so far, we don't think actually that its recommendations require additional statutory provision, because what they are suggesting in terms of the cap and the means threshold, that can be dealt with through regulation. So it does not mean that its proposals necessarily need to be put on the face of the statute as ours do. As to the relationship between what they're recommending and what we are recommending, obviously we liaised during the course of preparing our report and vice versa. So the recommendations made by both commissions are entirely compatible. And in particular, just drawing those threads together, the Dill Not Commission are supportive of what we're saying in terms of portability, in terms of the provision of information, advice and assistance, in terms of national eligibility criteria. So where does that leave us? We've published our report, as has Dill Not. Originally, the white paper from the government was to be at the end of this year. We understand now that that is to be next spring. It's gone back, we understand, because, possibly not surprisingly, the Cabinet is unable to resolve how it's going to come up with the money to implement the Dill Not proposals. But that is still the timescale. There is a parliamentary slot in the next parliamentary session, which is next spring, for the Social Care Reform Bill, and that would be or include our recommendations. The Minister has said that he doesn't propose to nitpick. That doesn't mean, say, of course, he's going to accept everything lock, stock and barrel, but certainly when I last spoke to him and had a conversation about it, he was optimistic, let's put it that way, that the bulk of our recommendations would be contained within the new Social Care Reform Bill. But who knows? Anyway, that is the position. Thank you all very much. It's just gone 11:15, so I'll go back to the chair and take questions.
Thank you.